Wallace, Businessolver's Chief Legal Officer. And first and foremost, I want to thank everyone for attending today's compliance webinar. I know everyone is super busy. We've got, a big year end, I'm sure, coming up for everyone, and a lot going on this month. And you're probably coming off of AE season and all the good things. So we are here to hopefully be informative and offer some words of wisdom leading into 2025. With that, let's go ahead and meet our fantastic panelists for today. Ben, I'm going to go ahead and start with you if you'd like to kick us off.
Sure, thank you, and thanks for having me. Ben Conley, I'm an employee benefits partner at Seyfarth Shaw.
And we'll just go right down the line there. How about Brooke?
Great. I'm Brooke Salazar. I'm the Senior Director of Compliance at ComplianceDashboard. Before I was a lawyer, I managed benefit plans, and I had the pleasure of having ComplianceDashboard right by my side. So the fact that I can now be a Senior Director of Compliance here at ComplianceDashboard, I'm over the moon to be here with you guys today.
And hi, everybody. I am Bruce Gillis, Head of Compliance here at Businessolver, and glad to be a part of the conversation today.
Yeah, this is great. Thank you, three. First, thank you for providing an hour of your time today to go through this, as well as the content, because we do really have a lot of great content and items we want to discuss. Before we dive into that, though, I think it's time for our very first poll. I love how our team around here does polls. I just love it. Okay, so for our audience, what are you hoping to get out of today's webinar? All right, so hopefully it popped up in front of you so that you're able to click on your computer and get your vote in. We have A, I just need to know what my immediate to-dos are to stay compliant for 2025. B, I want to get a better grasp on what major changes are in store for the next year. C, I need help just getting the basics under my control. Or D, something else I'll ask in the QA. So maybe think about it for a hot second. What are you hoping today? And I've heard you can only answer once, so you cannot answer all 4 times. So we want to make sure we start to hopefully we hit the hot buttons, and hopefully we get the results. I hope we have the material to cover what everybody wants. Okay, I'm starting to see the results are in. I want to get 58%. This is good. I want to get a better grasp on what major changes are in store for next year. Okay, that feels like right on time for our first, the next slide for our first topic. What's on the 2025 compliance horizon? Brooke, I'm going to start with you on this one. We're going to have Brooke, Bruce, and Ben. It's going to be a mouthful of B's today. Lots of names with B's. But Brooke, I'm going to start with you.
Okay, great. Well, a change in administration matters because the president is the head of the agencies. And so those agencies' priorities can shift when the administration shifts priorities. And so we're really looking to keep an eye on things that are in line with the new administration's goals. And that's what we're really doing here at ComplianceDashboard.
All right, Bruce, what do you think? What's on the 25 compliance horizon?
So, well, it's interesting, right? With the change of administration, we're seeing, and it's a significant change in administration, right? Because the parties have been relatively polarized. So we're seeing a lot of discussion about, again, revisiting ACA. That's been a post-election conversation point. There's a lot of conversations around reproductive rights, and so I think there's a lot on the table for potential changes, and I think a change, as Brooke said, when you look at all the directions and guidance that have come from the agencies. If it's not legislated and it's coming directly from the agencies in terms of guidance, then it can be more easily reversed. So I think it's going to be a very active first year next year, I suspect.
Okay, Ben, what do you think?
Yeah, I mean, I say this at every webinar, so people are going to discount it, but I think that this upcoming year is perhaps the biggest year ever from a health and welfare compliance standpoint, and I do really mean it this time. But putting aside the change in administration, which I think we all expect will have minor or major implications for health and welfare benefits, there are already some compliance obligations queued up in the hopper for next year that we're going to talk about in today's presentation. So, I think it's not going to be a snoozer of a year, needless to say, and there will be a lot going on and many things for compliance professionals to focus on.
Yeah, we've got a couple of things here, the other things to keep your eye on. Bruce, maybe the first one is yours, just touching very briefly. I think we might get into it later on in the session, but touching very briefly on those 2 points.
So yeah, web accessibility, I think that's it's a big item. There's some recent guidance that have come from the Department of Justice. We're going to talk about that in just a couple of minutes. And I think that while that particular guidance is directed towards public entities, WCAG compliance, so which is web content accessibility guidance, is we hear from a lot of employers that are looking into that, and that's definitely something that with the recent Department of Justice guidance directed towards public entities is taking on more than just a employer preference, but also becoming an employer mandate in some situations. So that's definitely an item that I'm keeping an eye on, that I think employers are going to be seeing more around. But I also, again, I mean, I'm going to jump around a little bit. I think there's going to be some challenges from an administrative perspective, because we've seen a lot of push come from the Biden administration to put specific guidelines in place and to offer kind of counterpoint protections around reproductive health. And I think we're going to see some of that revisited as well. And employers who are managing national populations, where you see the variability on a state-by-state basis, it creates a challenge for employers, because you have communications that you have to manage, you have employer expectations, and you have a health plan that in many cases spans multiple states, and you want to make sure that you're addressing those considerations and concerns to your entire population.
Yeah, and I think that's a great segue into our to-do list that we also have prepared on this slide as well. This is a great time of year, no matter what, if it's an election year or not. This is a great time of year to be looking at your policy, your employee handbooks, all the policies in those handbooks, to review your plan documents. I'm sure a lot of people have been working on that through AE season, and then also reviewing your privacy notices. And we'll get into that a little bit, because there are definitely some state-specific privacy notices that are on the horizon. They're here or they're on the horizon. So I think that's great. Okay, full of content for the session today. So let's go ahead and dive right in then to the first one. And I think Ben and Brooke, I'm going to sort of look to you two to facilitate and walk through this one, the mental health parity and the privacy final rule.
Sure. Brooke, do you want to start? Or you want me to start?
You know what, Ben? I know how much you love mental health parity, and I'm here for it. I am here for it, and I'm excited to listen to it.
I will just say I love mental health parity almost as much as the audience loves Bruce Gillis, based on what I'm seeing in the chat here. So I'll try to match the enthusiasm of the Bruce crew here. So look, mental health parity is a law that's been around for decades now, but there have been some meaningful developments in recent times. Most specifically, the government just finalized regulations in September that for calendar year plans will require or have already required immediate action. And what we're talking about here is a law that asks whether the benefits you offer for mental health and substance use disorder benefits are offered in a manner no more restrictive than what is offered for medical and surgical. Host of requirements under the law, and we could spend 2 hours just on the last 20 years. But most notably, starting in January, the DOL will be able to request from your plan, or a participant will be able to request from your plan, a comparative analysis comparing all of your plan's non-quantitative treatment limits and the processes and application with respect to mental health benefits as compared to medical benefits. So a non-quantitative treatment limit is something like a medical necessity standard or a prior authorization requirement or network admission standards for your providers. And this, what the agency or participants are going to be able to request is your analysis, looking at how you put those in place and whether the processes for doing so were in parity. That analysis will also be required to contain a fiduciary certification from your plan's fiduciary that plan fiduciary has engaged what's called a qualified service provider, which could be a consultant, a TPA, et cetera, to review those standards and to ensure that they are compliant with the law and that your plan's fiduciary is monitoring those requirements. Now, for many of you, this may necessitate a preliminary step of identifying who is the fiduciary under your plan, which is a big topic, an important one that we're going to talk about more later when we talk about litigation. But just know that you can't snap your fingers and have that certification in place. It does take quite a bit of work to build that analysis before the fiduciaries can certify, and that work should hopefully start sooner rather than later. We're seeing people predominantly start with their third-party administrators and engage consultants as needed to fill in the gaps, but that would be a great starting point. This is, by the way, a requirement that applies to all plans, whether fully insured or self-funded, and regardless of size of the plan. So if you have a health plan, which you probably do, otherwise you likely wouldn't be here, this is an obligation that will apply to your plan potentially as early as January 1st of 2025. Brooke, do you want to talk about the HIPAA deadlines coming up here?
Absolutely. So we saw a release for an update to the privacy rule for HIPAA regarding obtaining of health records of reproductive health care. Now, the guidance expanded the meaning of reproductive health care, everything from abortion to miscarriage to IVF to vasectomies, hysterectomies, etc. And it was put out to prevent states where reproductive health care may be restricted, or for instance, abortion is unlawful, from obtaining the records or subpoenaing the records from states where abortion is lawful. So for example, if your state restricts abortion and you go to a neighboring state, can your state request healthcare records from that carrier or from the plan regarding that procedure from where it occurred, where it's lawful? Now, practically speaking, because that's how I like to speak, what does this mean for group health plans? I'll start with the practical. Are they more likely, is the state more likely to subpoena the carrier or the claims? Probably, than your group health plan. However, group health plans do have responsibilities according to HIPAA, updating the attestation. So if one of those states requests information, there has to be language within the attestation, and you see the QR code right here on your screen to the model, which we love as HR folks, right? Well, I love a good template. Saying that this is not seeking reproductive health care information or records for criminal or civil or administrative sanctions. And that is due to be updated for group health plans by 12/23. And then the NPP is not due until the following year. However, we did see the Texas Attorney General file against this amendment to the privacy rule. And we know, since they filed in Texas, that no matter what happens, the prevailing party will probably appeal. And that'll go to the Fifth Circuit. And we know the Fifth Circuit is the most conservative in the country. And so that's one of those things that we're absolutely keeping our eye on as it filters through the courts, and to watch what the agencies do regarding those appeals with the incoming administration.
Yeah, that's great. Ben, anything else to add to that one, or maybe walk the audience through the to-do list related to these items?
Yeah, so briefly, I think one of the questions a lot of people have is, do we need to worry about these rules? The administration's changing. Will these things change? These were both rules implemented pursuant to formal notice and comment rulemaking, both of which went through the whole process and were finalized. That doesn't mean that they can never be overturned, but it does take more time under the Congressional Review Act if a rule has been finalized prior to the new administration. So, whether these will be around in 5 years, I don't know, but will they be around in January? Yes, most definitely. So something to keep an eye on. So quickly on the to-dos, again, with mental health parity, most employers, unless you have a sort of in-house medical professional, aren't going to be able to do this analysis on their own. The rule contemplates that you'll engage what's a qualified service provider to perform this analysis for you. And as I mentioned, we would recommend starting with your third-party administrator and or insurance carrier, and you can quite simply ask them, please provide us your comparative analysis, and that'll get you probably in most circumstances 95% of the way there. On the HIPAA privacy, obviously the policy needs to be updated. It's not a heavy lift to add language to address the new reproductive health guidelines, and many employers are also addressing some new guidelines relating to substance use disorder benefits. A lot of other changes apply going into the next year as well, but clearly at the participant level, your pre-tax contributions and specifically the tax limits for pre-tax contributions, HSAs and FSAs, increase annually based on inflation. So to the extent that you have a plan that you typically tick those limits up based on inflation adjustments, that would be something to do now. State paid leave, this is a complex area for which there are hundreds of state and local ordinances that mandate compliance with various state leave obligations. So those are coming out fast and furious. So if you are certainly an employer with a diverse geographic footprint, that's something to keep an eye on. And then health plan networks, this is going to come up back in the mental health parity zone as well, where one of the biggest challenges I think employers are facing from compliance with mental health parity is a dearth of mental health professionals within their networks. Not something you can necessarily change on your own. You can't necessarily go to a big national insurance carrier and say, add some mental health professionals. But what we've heard from the Department of Labor is that by asking the question, you are sort of discharging your fiduciary obligation to try and take steps to expand your network. So something worth looking at once you get those analyses from your providers.
Mm-hmm. Yeah, no, this is really great information and a lot of good helpful hints, right, as we head into the new year around just even these few changes to come. Okay, I'm going to switch gears a little bit because now we're going to turn to emergency relief for natural disasters. It was another unfortunately busy year in 24 with some natural disasters, and the government has come out with some relief rather. Bruce, can you walk us through what's going on right now?
Absolutely, thanks. So I'll take 30 seconds real quickly for kind of a history lesson. Prior to COVID, it wasn't uncommon to see if you had a big hurricane, Hurricanes Katrina, Hurricane Rita, right? The DOL would provide relief, but it was more general relief that would be provided. It wasn't as prescriptive as what we saw when we got to COVID, and we had that very prescriptive COVID relief that said, we're going to basically create a period where we disregard anything that happens, like the timelines for this period. So if you get 60 days to enroll in COBRA, we're going to ignore this, several year period for COBRA purposes, and then count the 60 days starting at the end of the relief period. Well, following Hurricanes Helene and Milton, and the devastation that was there in the southeast part of the U.S., the DOL and Treasury came out with additional relief, but they adopted the COVID relief model. So essentially, rather than being vague and say something like, hey, plan sponsors, plan administrators, you've got to work in the best interest of your participants, they've said, we're going to go that same route, and we're going to disregard for, COBRA payments, COBRA enrollments, reporting certain COBRA events, reporting disability determinations, things like that. submitting claims for reimbursement. We're going to disregard the period from the date of the hurricane until May 1st of 2025. And so there's kind of a lot to take away from here. And I know any of these topics that we're talking about today, we could probably talk about for an hour. So I promise I'll try to be quick about this. But you know, it's a little bit more challenging, or maybe perhaps it's a lot more challenging this time around because it's more geographically restricted, right? It's one thing to apply one set of rules across the entire US. It's something else to say, here's how we want you to treat the eastern portion of Tennessee, right? So, you know, from an administrative perspective, there's a lot more challenge here, but it does follow the same pattern of relief that was adopted with COVID. So it applies to all of the same things we saw with COVID around, you know, payments, claims, appeals, you know, special enrollment events, things like that. No communications update mandates, right? So, and there is other relief. So just to kind of touch on the comment where it says this does not cover 401k relief, there are other types of hurricane relief, but what I'm talking about right now is just the portion that really focuses on the health and welfare space. And that is, you know, it affects the claims and that's this particular set of relief with the 5/1/2025 relief period. So, you know, definitely something that employers, plan sponsors need to be looking at and talking to their COBRA administrators, their TPAs. It's not just COBRA, right? Claims, it'll affect a variety of different health and welfare plans. So you want to definitely be aware of it. Now I'm going to offer my 2 cents. I don't anticipate this to be as highly utilized as the relief we saw in COVID, because you don't have the same level of like high unemployment that came out of that. You don't have the same, so you don't have some of those kind of additional criteria or impact items that were pushing people to need some of the relief that was available in COVID. Or to the extent that there are people that are facing that, it's a much smaller number of people in much more geographically restricted areas. But you know, your to-do list, I'm just running across the whole slide here. Review your impacted employees, right? You know, the areas where you have specific people. There are not any mandated communications, but if you want to send a communication, you know, obviously nothing prohibits that. You know, where there's a need to reprocess claims or to handle appeals, you know, talk to your COBRA administrators and TPAs. It would not surprise me if you don't see administrators taking the position that we want to address states as a whole and not carve it out by county as the relief is rolled out. Because, right, not every, it just from an administrative perspective, not necessarily every administrator may track by county. So I would anticipate we're going to see some of this. The other thing that I did like about the relief that I thought was attractive relative to the COBRA relief that was provided was the relief does call out the opportunity that it is appropriate and acceptable for a plan to terminate someone for non-payment or to stop paying claims and who is on COBRA. And then later, if they make a payment, to extend their benefits and pay claims from that point forward. So that was one piece of guidance and one perspective that I think we learned from the COVID relief that you know, they didn't provide that level of detail at the time that COBRA administrators, claims administrators, TPAs were dealing with that. So it created a little bit additional complexity. But you know, again, this is something we're watching. We're on top of it. Like we'll see this relief. The way it works is just like with COVID, you disregard the period until May 1. So if somebody has 60 days to enroll in COBRA, they will have until 60 days after May 1st, 2025. So just something to keep in mind when you are looking at or you know, you're handling your COBRA populations and your various claims populations or appeals, that this relief exists. So I know I was talking fast, but I know we've got a lot to cover.
I think that's good, Bruce. So where should our audience go to look for the areas where the relief is offered? You know, how do we build the impacted employees list, right?
So, yep, absolutely. So first I'm going to address the question, what is a QEN? And I apologize. I say it so often, I don't even realize when I'm speaking in acronyms. Qualifying event notice, which is essentially the COBRA election notice that is sent to COBRA participants following a COBRA qualifying event. That's what a QEN is. But where do people go? The IRS and the Department of Labor both have websites that track and where they publish their relief. And we can provide the link for that. It's also you can Google, emergency relief Department of Labor, and you'll be able to find it. But they have, you'll see all the different relief that's available, not just that which applies to health and welfare, the Hawaii wildfires, et cetera, different pieces of relief that get published. Something that, I check on a recurring basis when there's a more large scale natural disaster, just to ensure that we are staying current and that our processes are updated appropriately.
So both sources should be checked, right, Bruce?
Yes,
both
both sources. Yes, oftentimes you'll see IRS will publish relief that is specific to taxpayers that may not be captured in the Department of Labor side, and vice versa. You see, there's a little bit of variance. This relief is large enough that it was published by both.
Okay, yeah, that's great. Awesome. Ben, did you have anything to add to this, or anything else for employees to do related to the impact list or information available?
No, I mean, I would reiterate Bruce's point, which is that this one's a little bit more challenging given the narrow geographic scope. I would encourage employers to exercise flexibility when it comes to application of the relief via geographic area, right? So, Bruce and I were emailing about some scenarios where you have a employee who loses coverage and the employee resides in a non-disaster area, but they may have a dependent who resides in a disaster area. And recall that COBRA qualifying events trigger a enrollment right for each covered qualifying beneficiary. So you might have a child who went to college in North Carolina who was impacted. And so regardless of how you set up your systems vis-a-vis targeting a specific individual based on their region, if someone appeals and says, I missed the deadline because I was in a hurricane impacted area, subject to coordinating with your carriers, we encourage you to exercise flexibility there, because that's the way the Department of Labor is going to look at the situation.
Okay. Yeah, that is great advice for the employers. Good. All right. Next up is fiduciary governance and welfare. And I think we're going back to Brooke and Ben on this one. Excuse me. So all kinds of fun information going on here. Brooke, do you want to kick us off on this topic?
Absolutely. First, I love to begin at the beginning. So let's talk about what a fiduciary for your group health plan actually is. I know sometimes it can be confusing. Maybe I administer the plan, maybe I record keep for the plan. Does that make me a fiduciary? And the answer is no. It really depends on what your actual responsibility with the plan is. So if you're just performing ministerial tasks, you're not a fiduciary. Absolutely. And while I'm talking about fiduciaries, I'm just going to talk about the to-do list really quick. Take a peek, just like any employee benefits lawyer, I'm going to say, look at your plan document. Like, how many times have we heard that, right? Well, what's your plan document say? So while you're looking at your plan documents, take a peek and see who your named fiduciary is, and make sure that name is up to date, and it has more to do with that functionality. Are you managing the plan in the best interests of the participants? So that's where we start. I will let Ben jump into the pharmacy benefit laws, because I've never seen anybody so fired up and excited to talk about PBMs, which is pharmacy benefit managers, laws at the state level, as opposed to Ben when we were talking about this. And I'm worried I cannot bring his level of enthusiasm to it.
I appreciate that, Brooke. I'll do my best here. So PBMs are obviously the middleman, if you will, between the pharmaceutical drug manufacturer, the pharmacy, and your health plan. And it's hard to say we didn't see this coming, because what's happening now is building on years of litigation surrounding fees in the context of 401k plans, alleging that due to negligence on the part of the plan fiduciary, participants were overpaying fees, and that snowballed over time, resulting in massive losses to the plan and its participants. That was an easy focus for 401k plans because they are asset accumulation plans. So even a small misstep from a fee standpoint can add up when you add a spread across the entire plan and all its participants and time value of money, et cetera. It's a little more complicated in the context of a health and welfare plan, but what plaintiffs' attorneys are attempting to do now is to allege that plan fiduciaries, which again is somebody named by your plan, right? So every plan must have a named fiduciary. And that's the entity, person, individual responsible for selecting plan service providers, monitoring their fees, determining whether their fees are reasonable. And the lawsuits allege that plan fiduciaries, in the first lawsuit, it was Johnson & Johnson specifically, selected their PBM based on improper metrics. Obviously, Johnson & Johnson is a drug maker, so they had a lot of interest in the prescription drug lineup under their plan, the formulary. The lawsuit alleged that they relied on a service provider to help them determine whether fees were reasonable, that had bias because that service provider was paid based on the amount of claims incurred under the plan. So they had a motive to select a more expensive service provider. And then broadly, the allegation was that the plan had negotiated through its PBM prescription drug prices that were well in excess of rack rates available in pharmacies. I mean, it's an interesting read. And if you go through the 75-page lawsuit, you can see mostly lists of examples of, look, here's this drug price if we went into Walmart and bought it, and it was $17 and your plan paid $17,000 for this drug. Making the case that over time these amounts accumulated and led to participants overpaying for those plan benefits. There were some unique things about the Johnson & Johnson case. Most notably, that plan was funded by trust, which we know in the health and welfare context is a bit unusual. But that's significant because when you are alleging a breach of fiduciary duty and overpayment of fees, you have to tie it to plan assets. And typically in the health and welfare context, that's only participant contributions, which we all know is just participant premiums, and the rest is paid by the company in most circumstances. So if the company negotiates a deal and the person most harmed by it is the company, it's harder to make the case that there's a breach of fiduciary duty and a loss of plan assets. But in the context of a plan funded by trust, even company dollars are plan assets because they flow through the trust. So Johnson & Johnson was an easy target, and the couple other lawsuits we've seen arise in this context share that profile. All that said, we know that this is going to be an increasing focus, and there are some other prominent plaintiffs' lawyers in this space who are also making waves and sending out information requests to employers saying, tell us about how much you're paying for services. And by the way, there's a pretty easy way to make the case like the plaintiff's lawyers did in the Johnson & Johnson case now, because all plans now have to have a cost estimator tool. This is something that never existed before the Consolidated Appropriations Act. And I think we were on a Businessolver webinar, Bruce, you keep me honest, we were talking about, look, this in theory is a great new tool because it can allow participants to be effective consumers. But what we're afraid of is that with all this data, the machine readable files publishing all the payment rates and the price estimators, the people who are going to use these primarily are plaintiffs' lawyers, and they're going to use those to make the case and file a lawsuit. And that was actually a prediction that was right. Most of our predictions aren't right, and so we never revisit them. Nobody needs to walk through all the bad predictions we've made over time, but that was one that was right because that's what's happening now is the plaintiffs' lawyers are using those price estimator tools. They're sending letters to the plan saying, please send me a link to your price estimator tool. And they are simply typing in a prescription drug and then looking at the online rate through GoodRx or Walgreens or whatever the case might be, and lining all those up in their lawsuits. So all the more reason why it makes sense to, number one, identify who is the fiduciary under your plan, right? A lot of companies don't really think about this, and it's fine because you historically haven't had to worry about it, but a lot of companies just name the company as the fiduciary. And that might be problematic, especially if you think of the concept of a company acting through its ownership, board of directors, et cetera, who are typically individuals who aren't really focused on the fees they're paying to the PBMs, right? So it makes sense to think about who is actually doing that, and then having some sort of delegation set up where that person is actually the named fiduciary for your plan. A lot of people are thinking about whether that should be a committee. Doesn't have to be a committee. The process is more important than the structure, but the benefit of having a committee doing that is that committees have a natural process whereby they create a record of the actions they've taken, right? Committees have meetings and they have minutes from those meetings. And what we see in these lawsuits is they look back to a 6-year period and say, tell me all the processes you went through over the last 6 years to select plan service providers and to compare options. And if you have a committee, you're going to have notes, hopefully, that say, you know, on this date in December of 2018, we went through and we looked at these 2 options and decided this was the best option. Beautiful fiduciary process that insulates you even if that didn't end up being the best option. Whereas if you have an HR professional who's your functional fiduciary or designated fiduciary, even if that's a great HR professional, unless they are typing themselves notes along the way saying, today I looked at these 3 service providers and decided this was the best one, that's going to be harder to recreate 6 years down the road, especially, by the way, if people cycle over and that person's no longer in that role, or even with your company by the time you find yourself embroiled in one of these lawsuits. So again, you don't have to have a committee. It's fine to have an individual or a benefits department, et cetera, but documentation is becoming increasingly important, and documentation demonstrating you have good processes for vetting your, specifically your medical and prescription drug vendors, and making a decision based on permissible fiduciary factors, which would include, you know, considering the interest of the plan and its participants. All of that is becoming increasingly important. Just hearkening back to our earlier discussion on mental health parity, the plan fiduciary is also the entity responsible for doing the fiduciary certification for mental health parity. So again, another reason why you need to know who that fiduciary is, because by January 1st for most plans, that fiduciary will need to certify they engaged qualified service providers to perform this comparative analysis. Brooke, do you want to talk about the tobacco litigation?
No, I really
Okay.
don't. I'm going to tell you, I feel like you were so excited about that one.
Yeah,
I do want to point out, when we're talking about the fiduciaries, and it feels like I can feel the HR folks like this feels like a lot, right? Like I'm just trying to manage day to day. This feels like a lot. Where do you think the importance lies from your processes and having good processes to what the end decision was? Like if you had to counterbalance that, right? So are we asking, you know, maybe our poor HR person or whomever that fiduciary looks like to make the most perfect decisions all the time?
No, no. And in fact, there is 20 years of case law on the 401k side that validates the most important tenet here, which is the process is more important than the outcome, right? So if you're going to choose a higher cost service provider, that's actually fully justifiable. If, for instance, that service provider has a bigger network of pharmacies or a more specialized network of pharmacies based on where your participants live, et cetera, et cetera. But if you don't have anything documenting that we went through this process and looked at it, and that was the factor that was most important to us, and that's the reason why we went with the higher cost provider, all you have at the end of the day is evidence that you chose a higher cost service provider with no justification as to why. So again, you know, you don't have to guess right. It's very important in the context of 401k plans where you have stock and the performance is variable, et cetera. You don't have to guess right. You just have to have a process for thinking about the relevant factors, which is the cost, network, experience for participants, et cetera, and documenting the basis for the decision you made. And again, that documentation can happen with an individual, with a benefits department, with a committee. There's more than one way to get there. And the absence of documentation is not the death knell. It just makes your life easier if you're trying to recreate that down the road.
So I will say that if we go back to the tobacco surcharges, I really appreciate that because it's the outcome versus the process, I think is just such an important point here.
Sure.
I have had executives come in and say, how can I save money with my group health plan? Right? Let's go ahead and surcharge all the smokers. That's okay, right? So, Ben, what do you say to that executive? Do you say, no, not maybe?
Yeah, I mean, look, with the tobacco surcharges, this is the latest wave of class action litigation we've seen in the health and welfare space. We saw, in prior years, we all gathered together and talked about the Cobra notice litigation, which has now fortunately waned. We're not seeing a lot of those lawsuits filed anymore because the plaintiffs' lawyers there strangled the golden goose and have learned that they are now, and this is always the way that these things work out, right? Plaintiffs' attorneys file a lawsuit, but they don't actually want a court to hear the theory. They just want to scare the company into a settlement. But if a case ever goes to trial and the court says, well, your theory's bogus, suddenly they no longer have that basis for filing these class action lawsuits. And that's where we are with tobacco litigation right now. So it's not illegal to have a tobacco surcharge. It's not illegal to have a non-smoker reward. This all falls into the landscape of wellness programs, right? And what we know from the Department of Labor and the EEOC is that you're allowed to discriminate based on health status as long as you don't discriminate too much and as long as you follow the designated process for doing so. So what the government has said with respect to tobacco surcharges is you can impose a tobacco surcharge on your health and welfare plan. There are a few guardrails you need to follow, including that you have a reward that doesn't exceed 50% of the cost of coverage, that you notify people that there is a reasonable alternative if they think it's unreasonable to try and meet the reward by becoming a non-smoker, and that if the person completes the reasonable alternative, that they have the ability to earn the full reward. You also have to tell people about that reasonable alternative in all materials describing your wellness program. So those rules aren't new. They've been around since before the ACA. They were later codified in the ACA, and they've been pretty stable over time. But what we are seeing is plaintiffs' attorneys targeting companies based on failure to adhere to those simple guidelines that we just walked through and outlined. Now, in some instances, what we know from talking to these companies is that they are actually adhering to those guidelines, but the plaintiff's lawyer found a former disgruntled employee who had a piece of open enrollment materials that talked about the tobacco surcharge, but that didn't walk through, here's how we comply with the HIPAA guidelines. And that was all they needed to file the complaint, right? Our number one line of defense for complying with or avoiding being in the crosshairs of tobacco litigation is comply with those HIPAA guidelines, right? Reasonable alternative, limit the value of the reward, full reward available if completed later, and notice of the reasonable alternative, and have your program structured to comply with those. But secondary line of defense is just hit people over the head with that, right? Because what we're now seeing is if a plaintiff's attorney gets their hands on a piece of literature communication from your health plan that talks about the tobacco surcharge, but doesn't explicitly walk through how you are complying with the HIPAA guidelines, that's all it's going to take for them to think, well, we have a reasonable basis to get past summary judgment, and that's enough to make it very expensive for your company to litigate. Whereas we think that if all of your materials talk about your tobacco cessation program, say, here's how we comply with the HIPAA guidelines for tobacco cessation programs, and go through everything, there's not really going to be a basis for the participant. There's no novel theory being levied here, right? There's no sort of constitutional right to smoke argument being made or anything in these litigation. It's simply allegations in the litigation that you aren't complying with the well-designated regulations. So if your materials demonstrate that you are, we're hopeful that that is going to be enough to avoid. But again, I know we're December 3rd here, so you may be past your open enrollment cycle, but open enrollment materials are your first line of defense here, because that's the thing that people are going to be looking at when they think about whether you're complying with the tobacco surcharge rules.
And that is this year's niche plaintiff case, right? I feel like every year we have something that's a little bit of for plaintiffs' attorneys fodder, and usually centering around those HIPAA notices and language and all that good stuff. So this is very, very helpful. Yeah. Brooke, did you have anything else to add? You said you go on and off mute, so just wanted to make sure.
Oh no, what my big takeaway I think from all of this is really watching that open enrollment material, as well as when you are pushing out information throughout the year on tobacco surcharge cessation. That making sure that those, I don't want to call them disclaimers, but the reasonable alternatives are very well seen by everyone. And so when you're looking at whether the electronic materials or the materials in the mail, just make sure that those reasonable alternatives are in there.
That's great. All right, broadening just perhaps a little bit, but not much from this topic, we are going to dive into how a new administration may change benefits. So I'm going to open up the panel to all three of you. Bruce, maybe I'll start with you. Give Ben and Brooke a hot second to take a drink. And, just sort of things that may be on the horizon or have been talked about or discussed. Yeah, give us some insight.
All right. Well, I think one thing that I think about with this administration is, what impact, if any, is it going to have on the Affordable Care Act? There've been, I am always watching for, like when national level politicians speak about the Affordable Care Act and their intent. I saw an interview with President-elect Trump who said, we're going to repeal the Affordable Care Act. And then they said, you're going to repeal it, or he said it's out of here or something to that effect. And they said, you're going to repeal it. And he said, well, we're going to refine it. And then Lindsey Graham said, reconciliation process, here we come. And, I think there's, this is something that, it's been talked about. The Affordable Care Act at some point, there's a lot of strictly looking at this from an employer perspective, right? There's a lot of benefits eligibility decisions that are made based on the requirements of the Affordable Care Act. So this is something as an employer, I would be watching, what's going to happen here, because it affects not only the reporting that requirements that occur in the first quarter, but, employers drive benefits eligibility for their variable hour populations based on hours worked and the 30-hour requirements in the Affordable Care Act. So this is something that I'm watching. Another item just to call out is the ICHRAs, the individual coverage HRAs. This is something that prior to COVID was getting a lot of attention. Department of Health and Human Services was holding symposiums on this. A lot of employers were exploring this, and it was getting a lot of attention. I've seen more employers that are asking questions and exploring this in recent months. And this is something that came about during the first Trump administration. I am expecting that we will see additional focus on ICHRAs and consumer-based accounts, which is a oftentimes Republican touted approach to healthcare. And I anticipate we'll see more tools made available and more promotion of the consumer-based accounts as we go forward into the next year and a half. And I can keep going, but I want to make sure I give Brooke and Ben opportunities to weigh in on these items. Oh, one item I do want to talk about before I give them a chance to speak. I mentioned before that the Department of Justice had released a final rule revising some components for the Americans with Disabilities Act, specifically around non-discrimination for public entities and through the web. I read the particular guidance and it suggests, I question whether it would apply to an employee benefits program internally versus something that's more public facing. However, I've heard from a few employers that have been questioning the WCAG, again, Web Content Accessibility Guidelines standards that are required by this, asking about, our employee benefits administration platforms. This is something, if you're a public entity, something definitely to look at. We also hear private sector employers asking about this. Businessolver is WCAG 2.2 level AA certified. Workterra is WCAG 2.1 level AA. This requirement for April 2026 for public entities is WCAG, it's their level of certification, WCAG, level 2.1 level AA. So basically, the Workterra and Businessolver platforms both meet the requirement already, well ahead of the April 2026 requirement. But just want to call that out because, again, I've heard from a couple of employers that were looking into this, and in case I can preempt other employers in the public sector that might be questioning this, to provide that information. Those are among the items that we're watching in the short term. I don't see the disability piece being necessarily driven by the new administration, but just calling that out because it is something that is around the corner, and I want to make sure that we, shine a light on that as well for those employers that it may apply to.
Yeah, and I can jump in here and just flag for everyone that there are two big things happening in 2025 that have potential significant likelihood of impacting employee benefits. And those are the expiration of the Tax Cuts Jobs Act, which passed in 2016, which means that if Congress doesn't act, all of those tax provisions stemming from that law would expire. The other big change or big thing happening is that Congress has to pass a budget bill. And what we know is that when Congress has these big omnibus bills, both from a tax perspective and from a budget perspective, they quite often include some sort of benefit goodies in there. These could be small things like tweaking the commuter benefit limits and or tax exclusion deductibility, or they could be something pretty significant. One of the things we recall being on the table in the Tax Cuts and Jobs Act was an elimination of the employer exclusion for employer-provided health insurance, because that's a huge budget item. It's one of the biggest budget items from a tax revenue standpoint that exists in our government. Now, employers didn't love that, needless to say, when that was proposed last time around, and it strikes me as unlikely that Congress would go back and get rid of that tax exclusion, but it was on the table last time, could be on the table this time. By the way, the other thing that went away was the individual mandate penalty, right? That was previously, up until Tax Cuts and Jobs Act, an obligation or a penalty that applied if people didn't have health insurance, and that went to zero. But it wasn't eliminated entirely. The individual mandate's still there. It's just the penalty is zero. So in the absence of congressional action, that could be reinstituted. So just a reminder that kind of all things benefits relate to taxes in some respects. So those things are likely all on the table for the next go around.
Yeah, these are really interesting things to look for, which then leads us next to the to-do list, right? Really good, helpful hints here to review your group health benefits plan docs, review transportation benefits, review all of your benefits, right? Sick leave, travel, etc., and then review equity of overall plan designs. That is going to lead us into our second and final poll of the day today. How do you keep up with your compliance to-do list? So again, you should get the voting mechanism to pop up on your screen here in a minute. And A is remembering to check newsletters, DOL, and other websites. Do you partner with your compliance and or legal team? C, do you outsource it? Or D, I don't, please help. So quick preview ahead. If you do click and vote for the fourth one, we do have some things to help after this. So, but while we think about it, we've gone through a lot of information today. I think we've given some really good to-do lists, and recognizing that it can't all be done at once. That's fine. We just gotta prioritize and keep chipping away at it, right? Oh, the results are in. At 53%, it's partnering with my compliance and or legal team. Wow. That impresses all of us sitting on the panel today. We all love to hear that. No, that's absolutely great. If you did select D, I don't, please help. We're going to get to that in a minute. Sorry, Laura. My marketing team is telling me I skipped one. So I need to, It's okay, Laura. We'll go to the next one. All right. In line with Businessolver, sort of how we end our meetings and our sessions and our other webinars, it's the one last thing, right? Or the one thing. And so instead of letting Ben and Bruce and Brooke kind of have a free-for-all, we sort of threw in some one things that we'd like you three to talk about on how our audience can future-proof compliance. So Brooke, I'm going to start with you, sort of using the 5 here at your disposal.
I'm an automation girl through and through. I hate saying, does this apply to my plan? What applies to me? And next thing you know, I'm 15, 30 minutes deep into researching a law and compliance requirements that don't even apply to my plan. And I've just lost that time. So I love bespoke, tailored automation tools like ComplianceDashboard that take that manual element out of it and says, hey, Brooke, you know, you have this type of plan, you need to file X, you need to do this. It makes everything so much more seamless. And as somebody that's used it as an HR practitioner, I'm a big fan of automation.
Awesome. All right, Ben, what about you?
Yeah, just when we think about everything I talked about today, you know, help with mental health parity from your service providers, leverage on pricing, et cetera, all of those require contractual flexibility. So what my recommendation would be is if you are contracting today, think about the data that you need and the assistance you need from your service providers to try and make your goals happen with an eye towards where the fiduciary landscape is heading.
Great. And last, but certainly not least, Bruce.
Well, I'm going to cheat and combine 2 items here. Have a compliance process and build your compliance community, I think, are also key. And you know, I always say compliance is everybody's job, right? Not just mine. And I think it's really important to make compliance part of, well, I would say every conversation. That might be a little, you know, self-important of me, but really compliance should be part of when you talk about, oh, we're going to do a new product. Oh, we're going to have a large scale communication effort. Oh, we're going to evaluate a new benefit, right? Compliance is a part of all of that. And should be. And so even if it's, say, just checking the box, making sure, and, you know, Ben was talking about the need for process earlier. And I think there is a need for process across a lot of what we do. And factoring in, what are the compliance considerations? What are the compliance risks? And so making it, normalizing compliance as part of those conversations, I think is critical. You know, we all keep an eye on the future and we all are watching these, but making sure that you are, you know, actively focusing on it on a regular basis, I think is key as well.
That's great. Thank you all. And what we're going to show up on this screen, the last one is stay in touch with us. So here are some checklists and some great resources we've put together for you all with these great QR codes. So please use them. And thank you so much for joining us today.